Health experts have estimated that a fourth of the Kenyan population suffers from a range of mental diseases, including schizophrenia and other psychotic disorders, bipolar disorder, depression, and severe anxiety. In South Africa, 1 in 3 people will or have a mental illness, yet 80% of people with a mental illness do not get treatment. In Nigeria, fewer than 10% of those with mental health illness get treatment. Such is the story of many other African countries. As South Africa marks Mental Health Awareness Month, it is another opportunity to throw the spotlight on the state of mental health in Africa. Today on the program, we'll also shed some light on often neglected mental health disorders like depression, anxiety, and the many other personality disorders that have been overlooked. Remember, our discussion today is not substitute for medical or professional advice. If you need assistance, kindly seek the help of a professional. I am Keminni Amanor, and you're welcome to the Square. Joining our gathering today are 2 powerful women. Fatima Seedat is spokesperson for the South African Depression and Anxiety Group. She is joining us from Johannesburg, South Africa. And then in the studio with me is Bukola Lamid. She's a psychologist and mental health professional. Ladies, you're welcome to the Square. Thank you. I'm very happy to say ladies because I'm usually saying gentlemen or lady and gentlemen. Today is an all-women's affair, and we're discussing a really important subject, mental health. I want to start with you, Fatima. Let's talk about these usually overlooked diseases or disorders more appropriately, and what they are as far as the context of South Africa is concerned.
Hi, thank you for having us on air today. It's so important to create awareness around mental health and well-being, especially when we have these specific days. It's so important because the more we have people conversing about mental health and mental well-being and mental illness, the more people become aware of what's going on, and also just the awareness that's out there. People learn so much more. So when we look at the different disorders that we come in contact with on a daily basis, at SEDEC, we see different cases on every day. So we have people with depression, anxiety, substance abuse issues, a lot of trauma because, with crime, rape, gender-based violence, a lot of trauma does come through to us as well. And then you get your different anxiety disorders. So for this month, during Mental Health Month, we decided to cover anxiety disorders because throughout all our campaigns, we see that anxiety disorders is not much spoken about. And so every single week for this month, we've covered a different type of anxiety disorder. So we looked at post-traumatic stress disorder, which is PTSD. This week, we're covering panic because on the 10th of July, which was Monday, it was Panic Awareness Day. Next week, we're going to cover OCD, which is obsessive compulsive disorder, and then we're going to cover social phobia.
I see. Let's come back to Lagos and talk to Bukola. Bukola, are these common forms of mental health disorders in Nigeria as well? Because I mean, a lot of us loosely would say, I'm anxious about that, I think I'm depressed. But is it really a thing when it comes to diagnosis here in Nigeria as well?
Okay, thank you very much for that question. I think I want to start this way because, in Nigerian context, we have not really embraced mental health. So we are still even trying to grapple the concept of mental health. People think mental health, is synonymous with spiritual attack and all that. So we are even still trying to let people understand that mental health is normal. Everybody has mental health. If you don't take care of your mental health, that is when you become, when you have mental illness, okay? So when you're not looking at anxiety, depression, a lot of people don't know or don't want to accept that it is mental is because you're not taking care of your mental health. So we have it. In fact, like what you rightly said in your open conversation, that 1 in 4 Nigerian would have a mental health disorder. That is around 50 million Nigerians as we speak. So it's a lot. But even within that, because of the mentality that we have, is we have just less than 10% assessing this, you know, they don't want to find solutions to mental health, to their mental illness, because they feel that they don't have anything that has to do with, you know, I don't want to mention the name online, you know. There's this name they call people who suffer from mental illness in Nigeria. So a lot of people want to dissociate themselves from, because there's stigma. Because there's stigma, you know. So
we'll get into some of those challenges.
But we do have anxiety, depression. Oh, it's everywhere in Nigeria.
Absolutely. And you know, one of the things that I noticed, and I may have touched a bit on that, is the fact that, you know, the names for these disorders sound a lot like things that we go through every day, and so we take it for granted. They are things that come with our lifestyles. And so, Fatima, what is the nexus between our lifestyles and the mental health disorders that we face at every point in time?
I think it was so interesting that you mentioned that, like, on an everyday basis, we loosely use terms like, I'm feeling so anxious today, and you know, you have OCD, or, you know, because your moods are fluctuating, or we assume a person's bipolar. And we use these terms so widely and without any consideration of the actual terms and the meanings of them. So when we look at any mental health, mental illness, we have to see that when the illness starts, it impacts on your daily functionality, and then it impacts on the way you behave. So your behavioral patterns change as well. So together, you know, when we look at how mental illness impacts your life, it impacts how you operate on a day-to-day basis. If you wake up severely depressed, you know, not being able to do your day-to-day activities, simple things like waking up, having a shower, getting ready for work, leaving your house becomes such a big problem for you. And that is when you know you have a mental health disorder and you need to reach out for help.
Right. And while we are not performing any diagnosis on television, you know, I do want to, again, draw in the point, and Bukola, I hope you can, you know, take a bite of this for me. I want to draw in the point, but, you know, every now and then, I feel lazy. I don't want to do some of the things that you've mentioned, take a shower, speak to somebody, be indoors, you know, but then it goes away after a little while. At what point do we consider ourselves, oh no, I have a problem? At what point do we say that?
Okay, so that question is for me.
Yes, really. Bukola.
Okay, so World Health Organization gave an expansive definition of mental health so that people will understand at what point do they think they need to seek help. So I'll put it in this context. Said it's the state of your emotional well-being when an individual will be able to cope with everyday life stresses, okay? So when you don't have the ability to cope with everyday life stresses, I mean, as a psychologist, when we say the next time you come in for a session or something is when whatever you're feeling that is disrupting your everyday life, you know, day-to-day activity, when it is consistent, for instance, you are sad and you are consistently sad, for instance, maybe like for, you know, over 3 weeks, 2 weeks, and is disrupting your everyday activity. It's affecting you emotionally. It's even affecting people around you. It's affecting you as a person, and it is consistent. You know, like you said, a lot of us throw around this word, oh, I'm depressed, or I have OCD, like what Fatima said. But
yeah, there are even some who go as far as say, I think I'm bipolar.
Exactly. So a psychologist or a professional needs to assess you. There are assessments that we put in place to ascertain if you have clinical depression. But we have people who have long state of sadness. It doesn't really mean that they are depressed, but when it is beginning to affect you and it affects your thoughts, your behavior, your thinking, your day. I mean, because stresses are normal. You need to undergo stresses every day, but you should have the ability to cope. So when you no longer have the ability to cope and it's devastating to you, it's depressing to you, it's dangerous to you, it's demanding too much of your attention, then we begin to look that, okay, you need to see a professional. It has to disrupt your everyday activity for a consecutive number of days, maybe weeks or months. You're not doing anything, you're not productive.
Okay. So then it brings me to the question, Fatima. There have been times that people have passed away by suicide. And then the question is, oh, they were so happy. Does depression or do these mental health disorders also present themselves in different forms than we know? I mean, if we are with our friends, what should we be looking out for?
It's interesting that you asked that question. When we look at people that are suicidal or have suicidal behavior, one of the warning signs is change of behavioral patterns. And when we look at that, when they say, but they were so happy, sometimes the person's been thinking about attempting suicide for a very long time. And during that process, they're in this very dark, deep hole. But because they see themselves getting out of that hole, they become happier because they feel as if they're going to a happier place. Therefore, what happens is this person then becomes a happier person. Sometimes people mask the way they feel. So, you're going through a lot at home and you have a lot going on at work perhaps, but because you don't want to show that you are, you're vulnerable or you're not feeling okay, people often mask the way they feel just to get by on a day-to-day basis because they believe they need to be strong for their family members or for their children or for someone. So there's different scenarios for different people, and that's what makes mental health so, it's so unique in so many ways that each person presents themselves with different types of behaviors and different types of reactions to certain things. And that, it just makes it more complex than just looking at a person that has a different type of disease or illness.
Right. Are there any lifestyle choices that make a person more prone to mental health disorders like we have discussed? Bukola, you start on that for us.
Okay, so basically we have some individuals who have the genetic pattern. So when you see their family background, you have people who have suffered from mental health illness in their family. So you may want to look at that. Then we have external pressures. We have things in our society, maybe job demand, marital issues, but a lot of things can trigger mental health issues.
Right.
So we have intrinsic and we have external issues as well. So there are so many things. I mean, demand from job. Looking at Nigeria, for instance, I was telling someone some few days ago, I said, even living in Nigeria, you have to be very deliberate because there are so many things that can trigger mental illness in Nigeria. So you have to be very deliberate. There are so many things that can trigger you, can make you have anxiety. If you have too much of peer pressure, you can have sadness, comparison. There's so many things that is in our environment that can trigger mental health, that can, stagger our mental health.
Absolutely.
Yeah.
Fatima, feel free to take a dig at that question, but I also want to ask you, are there simple lifestyle changes that we could make to boost our mental health?
Most definitely. So when we look at, your mental health and well-being, we always encourage people to take care of their sleep patterns because you need a specific amount of sleep to just feel rested and okay. You make other lifestyle choices like exercise, eating habits need to be good. Stress levels, learn to de-stress. There are many ways you can do that. Always allocate some time to yourself, whether it's reading a book or taking a walk down the road. This, journaling is very helpful as well. So there's various methods that people can use so that they can take out some time in the day just to help them relax and feel de-stressed. And we encourage people to do that. Then there's just, between the three lifestyle choices, the lifestyle things like exercise, eating healthy, and having a good sleep pattern, drinking a lot of water as well. So these are just basic things that we can integrate into our day-to-day activities. But then there are things, and for each individual, again, some people would find it more relaxing to sit and watch, something on television, whereas some people would like to book. So you choose what you want to do, but self-care is so important to integrate within your week at least.
I see, and I guess it's also important to be each other's keeper, not only when, money is involved, but be each other's keeper and be intentional about it. But I do want to pick on something that you mentioned, Bukola, the demands of the job. So let's look at how our workplaces impact our mental health. What is it like here in Nigeria, Bukola?
Wow. So many things affect our mental health, like I have said. And using Nigeria as a case study, you will see that our everyday to day, let's use Lagos as an example. Lagos basically is a trigger environment for you to have mental illness if you are not careful, because getting up very early in the morning, Fatima spoke about having enough sleep. When you don't have enough sleep, there are some parts of the brain that affects you, that is affected. And once you don't have enough sleep, at least an adult should have between 6 to 8 hours of good sleep. And I'm not talking about waking up and sleeping intermittently. And when you're looking at Lagos, for instance, hardly will you see a lot of adults having that amount of time to sleep. That affects your mental health. A lot of people don't imbibe the culture of self-care. I tell people that self-care is not selfish. Then look, when you're looking at the work environment, look at things that are beyond your control. A lot of people, try to strive towards what they cannot control. Like Fatima said as well, these things are individualized. They are unique. What triggers you as an individual, even at work, your workplace, is different from what triggers your colleague or your team leader or your teammate in that particular space as well.
Right.
So you need to individualize it. These are my boundaries. These are what I'm supposed to do. So like journaling, like what she said, you have to look at it critically and know the things that are beyond your control and things that are not beyond your control. When you take it one step at a time,
do you find
begin
that, indeed, do you find that workplaces are intentional about mental health of employees or staff in their offices here in Nigeria?
Okay, I'm going to answer that based on my own personal experiences. I've had several companies, organizations inviting us as psychologists to come and speak with, their employees. And they have been trying, the federal government just passed a mental health bill of 2020 in 2021. So people are trying to adjust to, I'm talking about organizations that they're trying to reach out to psychologists, reach out to people who work around mental health services to come and talk, speak with, because you're first human before you're a manager or your supervisor. And whatever happens to you from the home front, you bring it to workplace and it affects your work productivity. So people are beginning to embrace the fact that, it is important that we deal with mental health in workspaces. And indeed, things are improving.
Absolutely. When we come back from this break, we'll hear the South African case of how, the pressure of finding money and funding our day-to-day lifestyle has on people's mental health and, how things are going among organizations in that country as well. Stay with us here. You're on The Square. You're watching Village Square Africa. Today we are having the all-important conversation about maintaining great mental health. We're discussing mental health disorders using South Africa and Nigeria as the case studies. Still with me here are Fatima, who's joining us from South Africa, Bukola, who's here with me in the studio, obviously based here in Lagos. Ladies, thank you so much for your patience on the program. I do want us to continue from where we stopped. Fatima, I was saying earlier that, the pressure of finding money to fund our day-to-day lives definitely does have put some pressure on our mental health. But how are organizations in South Africa plugging into the need to help employees maintain great mental health?
So in South Africa, we are maybe the largest mental health organization. And what we've done is we've provided specific toll-free helplines so that people can reach out and speak to a counselor over the phone. And sometimes it's just so good to have talk therapy with someone, and it helps you see something from a different perspective. So if you look at the mental health care services in South Africa, it's the least funded mental health care sector in public health. And that shows that, and you can see that through our work in various areas where we don't see much psychologists, psychiatrists available to do, do the assessments and see patients. And in the very few hospitals that we do have these services, they are so inundated, they are extremely busy that they don't even have enough time to do a proper assessment at times. And they have a huge waiting list, and people can go into the hospital, wait hours and hours, and then just be told that, we can't see you anymore. So they get turned back and tell them to come back on another day. So through our services that we offer, it's the toll-free lines. We have over 200 support groups nationally where people can join in and get some sort of support system and not feel isolated. Right. Then we start 2 pilot projects which are based in 2 rural townships where, informal settlements. And we've seen the need for these, face-to-face consultations and counselors that actually work on the ground. So we are looking to keep, that process where we open up more of these counseling containers going forward to assist more people that are just in need of help.
Yeah, Fatima, you've just catapulted us to, the next phase of our conversation. But just taking you back slightly, do you find that employers in South Africa are intentional about the mental health of their staff or employees?
We've seen a great shift after post-COVID. So during COVID, a lot of people became more aware of mental health and well-being and the importance of it. So there are a lot of companies and organizations that are integrating small steps towards, providing that as added mental health care or mental health support that they can give to their staff members. But I still feel like, there needs to be more awareness and also people learning how to do accommodated environmental changes for people living with mental illness. And it's a process, and because mental illness is so highly stigmatized, it's taken a while for people to start opening up and realizing that you can be a highly functional person regardless of your diagnosis of your mental illness. And just to provide that added support would help people at their workplace to cope better. And also they are able to function better in that way.
Right. Bukola, let's talk about Nigeria for a bit. The World Health Organization, as of 2015, had indicated that there was 1.4 psychiatrists to 100,000 Nigerians. Essentially, that data may have grown over the past decade or so. But what it tells us that there aren't enough psychiatrists in this country. What does it say about, the national or the collective intention when it comes to mental health?
Okay, you're very right with that statistics, but it's even worse now looking at the brain drain, the way people are living the society, the country at large. For instance, even at my workplace, you will just see that a lot of medical personnel are, leaving the country every day, and there's a lot of strain on the remaining professionals that we have in Nigeria. But to a large extent, the country is trying to see how they can manage the little resources that they have. Okay, for instance, here in Nigeria, I'm aware that we have a lot of schools, counseling schools that are springing up now, trying to train people who are not actually psychologists, but, you know, they can be trained to be a counselor, perhaps maybe a grief counselor, a family life counselor. So we are trying to, you know, bridge that gap between the big professionals, if I can say that.
You think people would like to go to therapy in this part of the world?
To a large extent, I would say looking at in the last 5 years, things are appreciating, especially after COVID, when people realize that, oh, things are really affecting them. So there are a lot of people that are beginning to embrace therapy, counseling. You know, we're beginning to even go through the religious route because we understand that basically a typical Nigerian who is being emotionally drained would rather go to a religious house to seek help. So we are trying to train all some of the religious leaders, the high people in the society, in you know, trying to make them to understand that it's okay not to be okay. Because you need to understand that first. We need to reduce the stigma. The stigma is very, very important in trying to reduce, because once we reduce the stigma, it's easier for somebody to come out and say, oh, I'm feeling this way. So, and that's the beginning of healing for people who are suffering from mental illness. So we have a lot of people coming out now, trying to become a professional in their little way and trying to fill in the gap for the professionals who are not enough.
Indeed. Comparatively, Fatima, South Africa seems to have a better, you know, mental health treatment regime for its people. And by comparatively, when you compare with other African countries, but within the country, it is still not enough, particularly when you consider the inequality that comes along with access to mental health treatment. So talk to us about what else you think the South African government could do, or organizations in South Africa could do, to bridge the gap and make mental health much more accessible, not only for people who have, but people who do not have as well.
I think the most important thing is to integrate a program like the one we run in. We have our counseling containers, and in essence, it's a shipping container that we've changed into office space. So it's 2 consultation rooms, and we placed it in the middle of a rural settlement or an informal settlement. And what we do is we create jobs through our program. So we hire people from the actual informal settlement, and that's what and we train them to become lay counselors. And through that, what we're doing is we you know, the process of just getting some sort of help. And getting just speaking to someone and getting that counseling done is important. And we've seen how we could bridge the gap between inaccessible mental health care and how we could work together with public healthcare systems. So we can be that initial, or if you put together this program and you have your initial stages where people get help, and then you take it to the next level. So if a person really needs more assessments and medication and all of that, then we can refer them onto a hospital and get further health care. However, if they just need counseling, they come to the container for a few follow-up sessions and see how it goes for them. I think that is so important, but also making sure that we have other added mental health care support systems, like your support groups, like our toll-free line, so that it's accessible to people 24 hours, and whenever they're not feeling okay, it could be at any given time. They have that added resource or help where they can reach out and get the help from.
I see. I want us to bring up something just before we talk about some of the challenges, practitioners like yourself face in trying to get treatment to people who have mental health disorders. But recently, South Africa, we know, is looking into plans to have a nationwide health coverage. How significant is it considering mental health? Is mental health a public health issue as far as that insurance scheme is concerned?
It is. So with the NHI, I'm not like, the thing is, South Africa always has amazing healthcare strategies and plans that roll out on a yearly basis, like with your mental health care policy and strategic framework, where people, they're these beautiful documents that put together a plan. However, when it comes to the rollout of these plans, the government does not or aren't able to roll it out properly. So same with the NHI, it may work. We don't know what the rollout will be like, but we over time we can only assess, and they haven't started yet. So
yeah, we'll wait and see.
We are hoping that the NHI works well, but at the same time, people, we're very skeptical as well.
We'll wait and see what happens then, Fatima. But here in Nigeria, affordability to private institutions for mental health treatment could be one of the challenges that people could face. What do you expect people in authority to do about this to ensure that, pricing does not become a problem for people who need mental health treatment?
Okay, I think one of the very basic things we can suggest to the federal government is to ensure that mental health communities or services is, included in primary health care centers. It helps the information or the knowledge to go deeper into the grassroots. So, the way people access basic health care at primary health care centers, we make it easier when we have maybe counselors or psychologists, when they have access to people at the grassroots. It's really going to go a long way. And we have to start with awareness first, because what we observed again is that we realize that a lot of people don't come out. They don't want to be associated with mental health, even though they see it. And another thing we noticed again in the federal government psychiatric centers is that we realize that by the time they bring in the clients into the hospital, it would have degenerated to, a lot of psychotic issues. You would have, when you go through their case histories, you would have noticed that they've gone there, they've gone to several other places, except, the right places. So if we can, take it from the primary healthcare centers, where we give talk, we create awareness, we embrace mental health, because we tell people that there is no other health without mental health. It starts with mental health. So when people begin to understand that mental health, it's, everybody should have mental health.
Right.
When you start from that basic, so they begin to embrace the fact that, mental health is a generally acceptable concept, then people begin to come out. Then the federal government can now try to help people in that mental health services to have access to people from the grassroots. It's very, very
maybe
important.
We can start with our churches and our mosques,
definitely,
where people go
definitely,
a lot.
Religious houses.
Absolutely,
definitely.
because one of the challenges in dealing with mental health issues are, the superstition associated with that. And that brings me to you, Fatima. Perhaps somebody no longer wants to go to the Sangoma, or maybe they have listened to us now and they feel that they need some help. How do they get in touch with SADAG?
So SADAG's available 24 hours every single day of the year. We have toll-free numbers. We have a WhatsApp line. So people in Nigeria can reach out to us on the WhatsApp line by messaging us. We have SMS lines. We have emails. Everything, all our details are on our website. So visit our website, which is www.sadag.org, and all the information is there.
Right.
Yeah.
Absolutely. And I can tell you that I visited the website. There are some self-help tools there as well. There are a ton of ways to contact SADAG. You don't have to be in South Africa to do that. Anywhere you are on the continent, you can get in touch with SADAG and seek some help. Bukola, is there any help for people in here in Nigeria as well? Yeah,
I'm looking at people who want to go online and order. We observed here in Nigeria that a lot of our clients are not online. They don't even have access to the internet. So most of the time, what we'll do in our own organization is to go to them. Go to schools, go to religious houses like what you have mentioned. We try to penetrate the grassroots because that is where we have, I mean, a lot of people who are exposed will understand to a large extent how they can take care of their mental health.
How to go to SADAG.org.
And all that. But we are more focused on those, those grassroots people who don't even know that in the internet, who don't even know how to access internet, and we go to them. We try to, bring it down to the barest minimum, how they can understand the basic principles of mental health and how they can take care of their mental health. So we have been on that for a long time.
Now, remember, if you're watching us from South Africa, SADAG is also on the ground. So, just visit one of the container places and get some help for yourself. It's important. Thank you, ladies, for your time and your insights on the subject matter.
Thank you.
Thank you very much.